Hello, this is Michael Wong from Grade 11 Science,
I'm
and
Lorenza from 11 Science.
today we're going to explain about the disease called cholera. The table of contents of what we are going to discuss here. So, what is cholera? Cholera is an acute diarrheal illness caused by infection of the intestine with Vibrio cholerae bacteria. People can get sick when they swallow food or water contaminated with cholerae bacteria. The infection is often mild or without symptoms, but can oftentimes be severe and life-threatening. The disease is transmitted through feces from the infected. Feces from infected human contain large amounts of infectious Vibrio cholerae germ that can infect others and contaminate anything nearby. Contaminated water. If the feces from infected person are not disposed correctly, it could contaminate water and easily transmit to another person. Infected person. If other person eats or drink anything that is contaminated with the bacteria, they will be infected with the disease. Concepts and etiology, their intestinal infection and its bacterial origin. After passing through the stomach, Vibrio multiply in the small intestine and to create a toxin which provokes a series of biochemical reaction. This results in watery diarrhea and severe vomiting. The first cholera pandemic emerged out of the Ganges Delta with an outbreak in Jessore, India. In 1817, stemming from a contaminated rice, the disease quickly spread throughout most of India, modern-day Myanmar, and modern-day Sri Lanka by traveling around trade routes established by Europeans. The three stages of cholera. The patient soon collapses because of dehydration. The classic signs are sunken eyes, hollow cheeks, absent pulse, and unrecordable blood pressure. This may occur at this stage due to dehydration and acidosis resulting from diarrhea. Stage of evacuation first, though. Abrupt onset with profuse painless, watery rice water, diarrhea, followed by vomiting. And at the stage of recovery, if death does not occur, a patient begins to show signs of clinical improvement. The blood pressure begins to rise, the temperature returns to normal, and urine output is reestablished. And now from here, Lorenza will explain the rest.
So the symptoms of cholera. 1. Dehydration. Signs and symptoms of cholera dehydrations include irritability, fatigue, sunken eyes, a dry mouth, extreme thirst, dry and shriveled skin that's slow to bounce back when it's pinched into a fold, little or no urinating, low blood pressure, and an irregular heartbeat. Second, diarrhea. Cholera-related diarrhea comes on suddenly and can quickly cause dangerous fluid loss, as much as a quart, about a liter an hour. Diarrhea due to cholera often has a pale, milky appearance that resembles water in which rice has been rinsed. The third, vomiting. Vomiting occurs especially in the early stage of cholera and can last for hours. The risk factors: reduce of non-existent stomach acid. Cholera bacteria can survive in an acidic environment. An ordinary stomach acid often serves as a defense against infection, but people with low level of stomach acid lack this protection, so they're at greater risk of cholera. Blood type O. For reasons that aren't entirely clear, people with type O blood are twice as likely to develop cholera compared to with people with other blood types. Poor sanitation. Cholera is more likely to flourish in situations where a sanitary environment, including a safe water supply, is difficult to maintain. Such conditions are common to refugee camps, impoverished countries, and areas inflicted by famine, war, or natural disasters. There are about 1.3 to 4 million cases per year worldwide due to cholera. 21,000 to 143,000 deaths worldwide due to cholera. Diagnosis: stool sample. Although signs and symptoms of severe cholera can be unmistakable in areas where it's common, The only way to confirm a diagnosis is to identify the bacteria in a stool sample. Rapid cholera dipstick tests enable doctors in remote areas to quickly confirm a cholera diagnosis. Quick confirmation helps to decrease death rates as the start of cholera outbreaks and leads to earlier public health intervention of outbreak control. Prevention. Clean hands. Washing hands to prevent cholera bacteria being consumed. Use safe water. Always use clean water to prevent using contaminated water. Peel food. Peeling food to prevent eating foods that are washed with using contaminated water. Clean surfaces. Clean surfaces to prevent being in contact with contaminated surface. Close the trash. Always close the trash just to make sure no bacteria comes out. Treatments. Rehydrations. The goal is to replace lost fluids and electrolytes using a simple rehydration solution. Oral rehydration salts, ORS. The ORS solution is available as a powder that can be made with boiled or bottled water. Without rehydration, approximately half the people with cholera die. With treatment, fatalities drop to less than 1%. IV fluids. Most people with cholera can be helped by oral rehydration alone, but severely dehydrated people might also need intravenous fluids. Antibiotics. While not a necessary part of cholera treatment, some antibiotics can reduce cholera-related diarrhea and shorten how long it lasts in severely ill people. Zinc supplements. Research has shown that zinc might decrease diarrhea and shorten how long it lasts in children with cholera. This is our references. Thank you.